Hey guys, welcome back to my channel First Time Mom. All of you who are here for the first time, please like and subscribe to my channel. Please press the bell icon so that you get the notification of all the updates right in your notification box. So guys, today we are here with one of the most asked question to me by all my audiences. I have been DM'd hundreds of time with this question. I have been asked, I have been messaged about a lot about a topic that says how to carry along with your pregnancy during the world of pandemic. So yeah, we are here to discuss anything and everything right from the start of your early pregnancy to the delivery, how to take care of yourself during this pandemic world. So guys, we know the virus is all around the globe. Everybody and anybody is infected and affected at least by this virus. There has been a change in our lifestyle, there has been a change in our daily life, there has been a change in all the office routines, and especially, yes, there has been a change in all the routines of the hospitals, in the daily life of the doctors, nurses, midwives, and everybody. I know it is how important to take care of your newborn and especially the unborn. I know how important it is to take care of the baby you are carrying in your womb. I know how sturdy the mothers are to take care of the baby when he or she is in their womb. So yeah, today we'll be discussing about some of the few questions about the same topic, how to take care of yourself in your pregnancy during COVID-19. So let's get straight to the topic. Don't mind me looking in my laptop screen because I have all the questions of my audience written in the laptop. So I'll quite at times look at my screen, so don't mind it. Let's begin first of all with the changes that have taken place in the hospitals or in the clinics where you'll go for your postpartum prenatal checkups, your ultrasound and everything. So yeah, if you're going into your gynaec's clinic or in a small place where you will be getting all your ultrasounds, the tests and everything done, they have made certain changes. Is what, first of all, you are only allowed to come by your own self. No, none of your partner is allowed, or your mother or anybody accompanying you is not allowed. For now, for the time being, only you yourself is being allowed in the hospital. As soon as you reach to the clinic, you give them a call. They ask you to give them a call. If you give them a call, they'll empty all the place. Most probably in the places where the pandemic is too much right now, there will be only you going to the clinic, one person at a time going in the clinic. There, the place where virus has weakened, yeah, there may be other people, but yeah, most of the places in my area, I'm living in the eastern side, so in my area it is only allowed one person at a time. So once you reach your clinic, you'll give them a call that you are in the parking area. They'll ask you about your COVID history, about anything and everything about COVID, if you have come in touch of everything, if you have been if your any family members has a COVID history or anything. Then they'll take your temperature and they'll allow you inside the clinic. Once you are inside the clinic, once again, when you go for the ultrasound, before entering the ultrasound room, you are again going to have a temperature check, and then you'll be allowed to enter the ultrasound room. Once you are there in the room, before lying down on the table, you'll be given a sanitizer to sanitize your hands. There will be a disinfectant spray used to sanitize the bed on which you are going to lie. Most of the time there is that sheet that rolls off with every person that comes in to lie on the bed. Most of the places it happens. The places where you have to sit on the chair or table or something, they just disinfectant it, they just use the disinfectant spray for you. Also guys, you have to take care by your own end. Please keep your hands clean, your body clean. Don't touch anything, don't touch the doors, don't touch the rails and anything, please. If you have to, because you are going by your own self, if you have to, please wear gloves and masks. That's mandatory for now. So please wear gloves and mask before going to the clinic. Next is all about how, if you are already in your pregnancy journey, how are you going to go ahead and handle it. or how are you going to visit the clinics. So whenever, like for the first time moms, whenever you feel like any change in your body or any mood swings, especially for the moms who have morning sickness or vomiting as one of the major factor in their pregnancy, most of the time if you don't feel right, if something is not right, do not feel scared to call to the doctors. They are there, they're taking care of everything, they will provide you with each and every possible solution they can. So please, if you are feeling low, if you are feeling something unconventional, please go ahead, give a call to your midwife or to your doctor. They are surely going to go ahead and help you. So the very two ways they are helping these days during the for the women who are pregnant is, first of all, if you are feeling low, if you are feeling unconventional, when you go ahead and give a call in the hospital or in the clinic, they make sure that they are able to provide the appointment over like advice over the telephone. They'll take telephone appointment, they'll advise you, they'll note down all your symptoms, all your functions, all your mood swings and anything and everything that you're facing. Then you can go ahead and ask about any solution they will provide you on the phone. They will try their best to avoid any personal contact with you. They'll try their best, when only when the things go out of control, then only they try and call you and get a personal appointment. Otherwise they'll try and take everything taken care on over the phone. So be sure, if you feel low, if you feel uncomfortable, if you feel like low, really like shivering or fever or any unconventional thing, please go ahead and give a call to your doctors and midwives, and they are there to provide you the solution. Now let's come back to a few questions that have been asked to me by many of my audience. So the first question: what if I have any concerns in the early stages of my pregnancy during the coronavirus pandemic? So yes, if you have any concerns during your early pregnancy, like bleeding or abdomen pain or heavy lower body pain, if you feel any of these symptoms, you can directly call to your gynac. They will either provide you a telephonic assistance, and if the things are already out of control, if anything that can't be controlled on telephone or on a call, they will direct you directly to the emergency department, where you can go ahead and first give a call to your emergency urgent care. They'll tell you what are the steps you need to follow before coming to the hospital. So don't worry, even if you're feeling anything, even if you're feeling the pain, or if you're bleeding, or if you are having a lower body pain, please go ahead, give a call to your urgent care, and don't take any risk during your early pregnancy. Next question is: how will the coronavirus pandemic affect my care at an early pregnancy unit? Okay, so not all women in their early pregnancy require an early pregnancy unit. Only some those who are suffering from ectopic pregnancy or PCOS or PCOD, they might need an early pregnancy unit to be taken care of. Again, they will first they will first take an appointment over the telephone, and then if the things are not under control, then they'll call you for an EPAU or early pregnancy unit. Next question is: what will happen if I have an existing appointment with the gynac? Okay, if you have an existing appointment with the gynac, please don't reschedule it or don't postpone it. During pregnancy, each month's appointment, each month's ultrasound is super important, ladies. So please never postpone it. Take ultra care of yourself. Please go to the hospitals or to the clinics only by yourself. Sanitize your hands, disinfect yourself, change the clothes once you come back. Take a shower, take a hot bath shower, clean up your hands, don't touch your face, and then you are like good to go. Don't worry, please go ahead. Again, I'll tell you once again, I'll repeat, they'll take care of everything. Again, they'll let you know if you can come into the clinic at the same time or if you need to wait. It will be only you who will go into the clinic, no other person will be there. So it will be only you, and they'll better be able to disinfect and everything and take care of you. Next question is: what will happen if I am self-isolating for suspected or confirmed coronavirus? Okay, if you are self isolation or isolating yourself, or if you have a history of coronavirus, or if you have been in contact with someone who have had the virus or who is having the infection, then you need to first explain anything and everything about yourself to your gynec. You are first supposed to tell him everything. How many days have it been during your self isolation, or how many days before have you been in contact to the other patient suffering from coronavirus, or if you already have it, how many days have it already been for you being on the medicine or self isolation. Please explain everything to your doctor. In this case, it will be more important or more necessary for the doctor or your gynec to take care of you, so that it doesn't reaches to the body. And guys, please make sure this is not the case that every time mother gets the virus, it is not necessary that if the mother has it, the baby too will have it. It's not really necessary. In most of the cases, it's okay, the babies, newborn babies, don't have the virus. But yeah, there is a high chance that if the mother is carrying, the baby too will have it. So please discuss all of this situation with your gynec, and they are there to help you. Don't worry, mamas, your gynecs are always there to help you. The next question is, will I be able to have an ultrasound scan at the EPAU? Yeah, no problem. There is no problem if you have an appointment booked, and if it's an ultrasound appointment, no problem, you will be taken care of everything, and your appointment and ultrasound will go on as it is. It's just that you have to be quite cautious about the cleanliness, and you just have to be quite cautious about what you are touching, what you're bringing to your face, whether you are touching your face or not, whether you are touching something unknown or not, whether you are sanitizing your hands or not. So it just depends on how cautious you are. Anything and everything else will take place as it is. Don't worry, mommies. The next question is, what do I do if I think I'm having a miscarriage? If you think you are having a miscarriage, then in this case, again, two situations arrive. One is a complete miscarriage, and the other one is like normal miscarriage. Complete miscarriage is something where you wait for your body to complete the miscarriage, to complete the remains to come out of your body automatically. The other option is to have surgery or medication about it. Again, if you have a miscarriage, or if you feel like you have missed your miscarriage, or you don't feel like having something nice, so please go ahead, discuss with your gynec. They will refer you to the urgent care if there is a lot of bleeding, or your bleeding doesn't stops within 24 hours. So they will definitely refer you to the urgent care, where your everything and anything related to coronavirus tests and everything will be first taken care of. Once the tests are done, then you will be straightforward transmitted to your hospital for any surgery or any hospitalization needed. But most probably for now, the hospitals are avoiding hospitalization. They are avoiding like contact with the person. They want it to be done over the telephone, or if any medicines is required, they are sending you the prescription, or to your farm, they are sending the prescriptions directly to your pharmacy, so that you can quickly pick up the medications over the counter from there. So don't worry, everything will be taken care of by your gynec. So now the last question to be asked by one of my friend is, what do I do if I have nausea and vomiting? I have already answered this question. If you have nausea and vomiting, if you're feeling low, or if you feel that you're too tired to do anything, something out of the box during the like whatever happens during the normal pregnancy, something out of the box, so please go ahead, call your gynec. They will let you know if they can solve the your problem on the phone. They will give you a solution there, or if they want to have an appointment, they will call you. So that's it, guys, today for pregnancy and coronavirus. Stay tuned video where I'll be discussing about how to go through your delivery, your postpartum sections and everything during this coronavirus situation. Till then, please stay safe, please stay clean, stay sanitized. Thank you so much for being here and watching my video, watching me chit chat like a chatterbox. Please pour in your questions in the comment box. If you have any questions, please write it down below. I'll be more than happy to answer all your questions. Thank you so much for watching. Bye bye.